Thank you, Mr. Speaker. It is always an honour and privilege to stand in the House of Commons on behalf of my community, Peterborough-Kawartha, and it is an even bigger honour when I'm able to speak on the issue that I believe is the biggest crisis facing our nation, mental health. Mr. Speaker, there isn't a person in this House or watching at home who hasn't been impacted by mental health. According to the 2020 UNICEF report, Canada ranks 31 out of 38 in children's mental health and happiness, and 35 out of 38 in teen suicide. Did you know that approximately 12 people die every single day by suicide? That's 4,500 deaths a year that we know about. Suicide rates are approximately 3 times higher among men compared to women, and suicide is the second leading cause of death among youth aged 15 to 34 years. And I should have put a trigger warning at the beginning of this speech in the event that this does bother anyone watching as we're talking about mental health and suicide. Self-reported suicidal thoughts, and please make note of that language, self-reported, and attempts are higher for people earning lower incomes, and as we know in this cost of living crisis, financial anxiety is impacting more and more people. What used to be considered good money is barely enough today. And I'm not going to get into the debate of carbon tax and this Liberal failure on cost of living. I really want to focus on what we can do today. Here's some stats that put this crisis into perspective. Incidences of suicide are higher in rural settings. Adults with mental disorders such as major depressive disorder, generalized anxiety disorder, and PTSD were more likely to report suicidal ideation. And adults who experienced pandemic-related impacts of isolation and loneliness were more at risk of suicidal thoughts. In fact, today I met with the Retired Teachers of Ontario, and they shared with me that mental health among their 83,000 members is a major concern. Many seniors don't have access to a doctor, and it is deeply impacting their mental and physical health. Almost every single day, I hear from a parent or caregiver who shares their despair, their fear about their mental health of their child. One gentleman started to talk to me one day, and he just broke down in tears because his teenage son will not come out of his room. He said, "The son I had before the pandemic and the son I have now is not the same, and I'm so worried for his future and his health." One parent shared with me that she waited 8 hours in an emergency room with her teenage daughter because she was having a mental health crisis. Mr. Speaker, we haven't even begun to understand the impact of the pandemic on our children. Their developing brains were exposed to trauma and isolation, and it will take years to get the data to understand the full magnitude on how our children have been impacted. I sit on the Status of Women Committee, and we recently completed a study titled A Step-by-Step Approach to Supporting the Mental Health of Young Women and Girls in Canada. And the study brought forth many witnesses and a list of recommendations tabled to this House, and some of which included education in schools, including self-regulation and empathy, and mental health first aid, supports in rural and remote communities, including clinical and virtual care, access to housing, access to virtual mental health care, providing transitional services for individuals who are discharged from addictions and mental health-related hospital programs, youth who are aging out of foster care, individuals who are leaving emergency situations such as violence. Another recommendation that came out included increased resources for health care practitioners. The reality is our frontline health care workers are suffering from compassion fatigue and burnout. As the old saying goes, the caretaker must first put on their oxygen mask if they are to help those who need it. Dr. Rakesh Jetley was one of many witnesses who testified in the study, and it was this quote that jumped out at me. "It is a 1.5 year wait for a psychiatrist for a teenager. 1.5 years is a lifetime at that age." All that information I have just provided this House seems overwhelming and a huge task to try and change the course we are on, but we can't give up. How do you climb a mountain? One step at a time. For many people watching from home, this place of debate can be extremely frustrating and painfully slow. Trust me, I know how they feel. And if the member from Kingston wants to continue to talk while I do my speech, I would ask that he respectfully leave. It is rude, Mr. Speaker, if you can please address that.
And I'll just make sure that conversations that are being held, just hold them outside, and we'll just get through the debate here. The honourable member for Peterborough-Kawartha.
Thank you, Mr. Speaker. This topic is extremely serious, and if you didn't intend it to be rude, I do take that back, but it's really serious to your constituents, to my constituents. But today feels somewhat exciting.
I have a point of order from the honourable member for Kingston and the Islands.
I absolutely, the member from Winnipeg North, and I respect the conversation. I apologize if there's some mistake. We were having a private conversation amongst ourselves, and perhaps we were too loud, and apologize to the member for that, but we certainly weren't commenting on the content of her speech.
Thank you for that clarification. The honourable member for Peterborough-Kawartha.
Thank you, Mr. Speaker. Today feels somewhat exciting because what my colleague has put forth is a simple, tangible action item that will move the needle in opening access to mental health supports. The member from Cumberland-Colchester, who also happens to be a doctor, has put forth a private member's bill, C-323, an act to amend the excise tax, mental health services. Currently, many health services, including optometric, chiropractic, physiotherapy, foot care, acupuncture, and many other services are exempt from charging goods and services tax, meaning GST or HST, depending on which province you live in. But psychotherapy and mental health counseling is not exempt, meaning the service provider must charge tax. If you remove the tax, that would work out to about every 8th appointment being free. The reality is many Canadians do not have coverage for psychotherapy and mental health counseling, and this would make a difference. This would also help alleviate the administrative stress on the providers. As I outlined earlier, these professionals are already managing an incredible workload to meet the demand. This would be a small but important help in making things more manageable. Mr. Speaker, how much time do I have? Thank you so much. According to the Centre for Addiction and Mental Health, or CAMH, psychotherapy is a general term used to describe a form of treatment that is based on talking work done with a therapist. The aim is to relieve distress by discussing and expressing feelings, to help change attitudes, behavior, and habits that may be unhelpful, and to promote a more constructive and adaptive ways of coping. Successful psychotherapy depends on a supportive, comfortable relationship with a trusted therapist. Psychotherapy can be life-changing for many people. It can be maintenance of your mental health, like visiting the gym to keep your body healthy. One of my favorite sayings is by Fred Rogers: anything mentionable is manageable. And that is exactly what psychotherapy provides: the ability to identify and name behaviors and feelings so you can better manage them. I would love to see everyone have access to psychotherapy, and this bill is a great stepping stone to making that happen, by making it both more affordable and also highlighting how important and valuable this service is. One of the biggest hurdles in accessing support is asking for help. We've come a long way in how we talk about mental health, but we have a lot further to go. Acknowledging access to mental health counseling and psychotherapy is a healthy and credible way to take care of yourself. And it's wonderful, but now we must ensure that we have access when people ask for it, and ensure those services are affordable. I want to tell you something from the Canadian Pediatric Society, and they wrote that behavioral and psychosocial problems serious enough to disrupt functioning and development affect approximately 1.2 million youth in Canada. Fewer than 20% receive appropriate treatment. Furthermore, they told the committee that support services can be very difficult to access, and that sometimes this lack of access to specialized services results in the doctor prescribing medications. We have an addiction crisis, Mr. Speaker. Don't discount how much this is connected. I want to leave everyone with a message from Dr. Stuart Shanker, another one of our witnesses from the Status of Women Committee. Dr. Shanker studies neuroscience and is a leader in teaching thousands of people about self-regulation. In his testimony, he said, "You can change every kid's trajectory." Every kid. And this goes for adults too. The science shows it takes a lot of different ingredients, but when you're able to access them, the results can be wonderful and life-changing. To everyone at home, wherever you are in your mental health journey, it is not permanent. There are amazing resources and people to help you. Your life matters. You matter. Today, I ask every member in this House to support Bill C-323, a private member's bill that says to Canadians, this House cares about mental health, this House recognizes the value of psychotherapy and mental health counseling, and this House is making it a priority to make it easier to access and to make it more affordable. Thank you, Mr. Speaker.
La période prévue pour les études des affaires émanant des députés est maintenant expirée et l'ordre est réputé au bas de l'ordre de priorité.